short lecture on postpartum exercise and nutrition. So what we're going to do is just hit the highlights of how you can help someone postpartum. I developed 2 manuals just out of my own personal frustrations, working with clients and myself, just trying to get people back to where they need to be, out of pain. Breastfeeding can just wreak havoc on the neck. I've survived a lot of things with breastfeeding. Took a toll on me more than anything else in my life. So just looking at some of the things that women can do postpartum is what this will focus on, just to get themselves, one, out of pain and safely get their bodies back. Because a lot of people are so excited to get their bodies back, but they push themselves so hard that they keep ending up back in pain or injured. So we will get kind of the quick and dirty on that. Because we only have an hour and 15 minutes, I won't read through a lot of the slides, but I tried to put as much detail in all the slides. So if there's an exercise in here, yeah, go ahead.
Is that good though?
Oh yeah, that's perfect.
The little square?
Yeah, the square, yeah, perfect. Thank you. So there's a lot of detail on how to do the exercise. I'll demonstrate the exercises. Some of them that we can do without equipment. I'll get you up, pumping the spine, just doing different things so you can just feel it in your own body. A lot of what you see up here doesn't apply just to postpartum, but to anybody that might have some issues going on. So the course objectives, we're just really highlighting some things that come up, like SI joint pain, sciatic nerve pain, getting the abdominal wall functioning again. I've worked with a man for a long time named Paul Check, and I've been in the industry for the fitness industry for a very, very long time, and he's done a lot of research on establishing communication with that abdominal wall again. So we'll talk about some exercises that really get the abdominals working, besides things like the crunch, and we'll go a little bit into the difference of it. If it's something you're really interested in, on my website I have different workouts. You're welcome to email me. This is my passion. I love it. So if you have any questions about some of the exercises or just yourself in general, you can email me about it. So we'll look at how postural exercises can help a lot. Yoga exercises help tremendously. Yoga saved me. I had to quit exercising when I was pregnant, and for me that was awful, absolutely awful. But my abdominals were so tight that I was down to just yoga and walking. And so I have a prenatal manual as well, just kind of encouraging women, if you have to slow down and your body's talking to you, you need to respect your body and listen to it. Looking at different cardiovascular guidelines. And then diastasis recti, the splitting of the abdominal wall that happens with a lot of women. There are sometimes ways to correct that just with exercise. Of course, you're always working with the physician and making sure that they're okay with that. And then the nutrition part, we're just going to do very quick and dirty, but mostly allergy symptoms, things that can come up postpartum that women aren't aware of that could be affecting them, and even just the general population. So the first thing we're going to start with is round ligament pain. So it's a sudden stabbing sensation in the groin area, usually on the bikini line. More, in general, people that are shorter, more compact, that tend to have the round ligament pain. And it's the stress as the uterus grows, puts a lot of tension on that. Some people never have it, some people have never heard of it. I've had extreme round ligament pain. It feels like preterm labor if you've never experienced it, and it's awful. And a lot of people don't know what it is, and they're like, well, just lay on the floor, you'll be fine. It's like, I won't be fine, I'm in labor. And then you start to figure out exactly what's going on with it, and we'll talk about some exercises that help relieve that. So if you are working with anyone that has extreme round ligament pain, it can last up to 12 to even 16 weeks after they give birth. So if they have it prenatal, chances are they may continue to have it postpartum. So round ligament pain is something that either you'll experience or you'll never hear about, but what I found when I was researching it, a lot of the journals didn't talk about it, what to expect when you're expecting, or all the different journals that are out there. They didn't, or they talked about it and it was like 2 sentences. So it's something that can really affect people. And one of the best positions someone can get into is the fetal position. And this lifesaver with a lot of different exercises. Putting the yoga block between your knees really helps not only with round ligament pain, but with the SI joint so that your knees aren't collapsing together. So this is a really nice position to help with round ligament pain. Cat-cow is another great way to help with round ligament pain because you're pumping the spine and you're starting to take some stress. It's always nice to have a couple of different options because one exercise may help one person and might not help another person. Bridges are another great way to do it. And then sacroiliac joint pain. I'm going to get you up. We'll try some of these in a little bit because you're going to see some of these exercises will help a lot of different things. So sacroiliac joint pain, and some of you in this room, especially if you're sitting a lot all day long, that SI joint, you can see kind of where the ilium, the ilium and the sacrum meet, that becomes fairly laxed. And when you feel like you're going to step back, you feel a little unstable there, or you have a lot of pain just across here, and it's different than muscular pain. It's when that SI joint becomes unstable in people. So as that joint becomes more and more unstable, you start to get more and more pain through the low back. So after someone's been pregnant and they have the weight of that baby in front of them for so long, what happens is it pulls that body into an extreme anterior tilt. So they've spent, 8, 9 months, and some people just in general, not being pregnant, spend a lot of time in this anterior tilt. What happens is that joint becomes even more unstable. So where you see that SI joint there, you start to get a lot of laxity in the ligaments there. So it creates a lot of pain in people. So the exercises that can help a lot, the sumo squat is an amazing exercise. And the reason being, if you do just a squat with your feet shoulder width apart, down and up, what happens is there's not compression of the SI joint. So let me just back up here. If you look here, the thigh bones, if they're straight up and down, everyone can see in the pelvis where the femurs would sit, where the thigh bones would sit like this. So where the thigh bones are, if I take it out in a sumo squat position here, you can see how her thighs are wider. So that creates some compression in the SI joint. So now, when you're squatting, your bones are actually helping compress that joint and create some stability in there. So this exercise in itself, if you only did that, helps a lot. It also helps if someone wants to do other exercises. This is a nice one to warm the body up, get the SI joint compressed, and then they can move on to do something else. So the sumo squat is just an amazing exercise. What you want to be careful of, and the description should be pretty good there, is you don't want to toe out so much. It's not a ballet plie. You're toeing out about 15 to 20 degrees, just enough. But if you go too much, then you're compromising. So now you're starting to affect the pelvis more because that femur is moving a lot further out, if that makes sense. So then you have all these wonderful cues on how to do the sumo squat. And it's nice to have the weight in front because it counterbalances, so you really have to use those postural muscles to keep the body lifted up. I love working out on the Swiss ball, and the Swiss ball or physio ball you see a lot now in birthing centers, and it's used everywhere. So it's a nice tool just to pass on. They can continue using it postpartum. So the supine hip extension back arm ball is another great exercise. If someone has trouble with the sumo squat and they need a little more support, this would be a good exercise for them to do. Later on you'll see it, I'm pretty sure in the slideshow, but sizing of the ball is really important. Maybe not so much during birthing and labor, it doesn't matter as much, but when someone's exercising on it, when you sit on the ball, your legs should be parallel to the floor, slightly higher. Because if this ball was really high and then I rolled out here, and my head's a lot further up, I'll really start to strain my back if I'm trying to get my body all the way up there. So she's on a ball that's perfect for her height. If that ball was a lot higher, she'd put a lot of stress on her low back. So supine hip extension, back on ball. And then this website, thelowback.com, has some really great SI joint stabilization exercises. So even if you're sitting all day and you start to feel some naggliness in there in the SI joint, these help a lot. This one laying down I've used a lot with clients. I've even had a couple of clients that travel a lot that would lay on the ground and do this on the airplane, because sitting in that position, the SI joint would be in a lot of pain, and he's like, I'd creep back there with my stewardesses and lay on the floor and do this. What's important about this exercise in particular is the knee is driving the exercise. So when you look at the picture, the knee is reaching forward. It's not, and when the knee reaches forward, and you can practice these in a little bit, the pelvis automatically rolls backwards. But what you don't want to do is roll your pelvis backwards. You want the pushing of the knee forward to create the pelvis rolling backwards, because what you're going after is not the muscles here, but the ligaments. So you want it to be very subtle. We're trying to get those ligaments to say, hey, you need to do your job and create some stability for me in my SI joint. So just remember when you're teaching that, and practice all these yourselves if you think you're going to work with someone and teach them. You can even, if you don't have much time with someone, if you just did the sumo squat, and then we'll get to some of the abdominal exercises, would be great. And I even have handouts on my website you're welcome to print out and use. So there's a couple of different ones. Seated and standing, they're similar, and what you're just trying to do again is create compression. So you can tell in the pictures the legs out to the side. So you're trying to get to a position where that femur can come in and lock down on the SI joint a little bit there. And the standing one, you can easily do against the wall. So sciatica affects a lot of people, and especially coming off of a pregnancy, that sciatic nerve takes a beating. A lot of times where the sciatic nerve feeds through a muscle, the piriformis, it's like your back pocket muscle there. Any of you are runners, a lot of runners experience issues with the piriformis. It can cause compression on the sciatic nerve where it feeds out of the spine. You can get compression if there's disc issues. There's all kinds of things that can create sciatica or sciatic nerve pain. And a lot of times it's on the right side, but it can be on the left or right side. It runs down the back of the leg, like that tingling feeling of pins and needles. So if people have sciatic nerve pain, there's some ways to help alleviate it. This kind of shows you where the nerve goes there on the pelvis, and talks about some of the causes of it. It can even be coming from the spine. If you suspect it's coming from the lumbar spine, it's good to at least know enough information where you could refer someone out to a chiropractor or physician, someone that might specialize in that. Because after being pregnant, some different things can start to happen with the discs. You can have different things happening with the muscles. You don't always know if it's coming from the lumbar spine, is it coming from a muscular issue. So here there's talks a little bit about the piriformis muscle, and it kind of, if you forget where it is, it's wallet sciatica, so it's where your wallet would be. A lot of times people will just say if you have that pain, it's piriformis syndrome, and it's kind of like the new fibromyalgia. They just say, they're not sure, they say, well, you have piriformis syndrome. And it very well could be. So it's exploring those options, and it's always exploring where you're helping someone and not hurting someone with the exercises. So these are some ways to relieve sciatica. The tricky thing about sciatica, and I've been working with clients for a really long time with it, is sometimes you can make it worse. So it's just choosing exercises. These are fairly simple exercises. If it does make it worse, I would refer them immediately to a physician or someone that can help. But things like the downward dog, spinal rotations, and you're going to have pictures of all these exercises. Baby cradle, upward dog, sciatic nerve mobilization. A really nice one for the piriformis is releasing it with a ball or foam roller. Twisted warrior, or a lot of the things that will help with SI joint pain will also help with sciatic nerve pain. And then some other ways, acupuncture, movement is always important. Just think too that sciatic nerve, if it has an adhesion,